all, we really trust women to do everything, and we trust them to care for everybody. And we need a system that cares as deeply for them as it should. And we need it to be across all of the lifespan of women, from adolescence to fertility years to menopause and beyond. And it needs to be in a comprehensive, collaborative way that doesn't treat women like individual organs. Instead, it treats them as a holistic person. And so I hope one of the things that this collaborative does is encourage women to take the time for themselves to do those diagnostic things and take care of themselves before something happens.
You are here today, as we heard, as both the philanthropist behind this groundbreaking new collaborative and as a patient. Can you tell us more about your personal health journey and cancer diagnosis?
Like many women, I juggle a lot, right? Friends, family, work, and all the stuff that goes in between. And I didn't really prioritize my own health care. I was totally negligent in getting my mammograms. And when I finally made my appointment, very quickly I was diagnosed with triple negative breast cancer. Anyway, I'll never forget my reaction. I was sitting there with Dr. Axelrod and I said, well, let's do the surgery in September, maybe late September, after the 4 girls go back to school. And she looked at me with sort of compassion and care and held my hand and said, no, we're doing this surgery as soon as I can get you on my schedule. And, I'm so grateful for her care. And that's part of the reason why we're here today.
What inspired you to make this investment in the Mignone Women's Health Collaborative?
I just really think that every generation of women deserves to have better, healthier, longer lives than the ones that come before them, and I hope this can be part of that.
Was there a specific moment or conversation or anything that sticks out at you as the time that you realized this was going to be the next step for you?
Well, I think a lot of you guys know I grew up in North Dakota. And we really only went to the hospital when we were bleeding or when we had broken a bone. And I saw firsthand how in small rural communities it was really hard for women to get the kind of care they needed. And how even today, 50 years later, a lot of conversations are taboo. And I think that my cancer diagnosis probably was the trigger point. It changed me. And I realized I didn't just want to get better. I didn't want to just, conquer cancer. I wanted to help rethink the way women experience care and get care and care for themselves. And NYU Langone, with incredible Dr. Grossman and the unbelievable Ken Langone and all of the other doctors and patients and doctors and staff and nurses, it was the perfect place to do it. And so that's why.
Dr. Behar, you've been leading the center for the past 13 years, doing the work day in and day out with patients like Allison. Can you share more about what you've built, starting with the Joan H. Tisch Center for Women's Health and now in partnership with the new collaborative?
When I was a resident, I was the only female in my residency in internal medicine. I too grew up in the Bronx. And I was the first female on the faculty in the Department of Medicine at my prior job at a different medical school. So I was me and 100 men in the Department of Medicine. So this was a really amazing opportunity. I was a resident with Andy Brotman. I've known him for many, many years, and he had been saying, come to NYU, come to NYU, and I was happy where I was working, and then one day I wasn't happy anymore. So I decided to come see the Women's Center, and it was the chance of a lifetime for me to work with women and begin actually my real journey in women's health, because prior to that I worked in a regular practice. So I came to the Women's Center, I saw it, I fell in love with it. I quit immediately my prior job and started working here. And it was life-altering for me. When people ask me what women's health is, I always say women's health is about choice. I never had the choice before to work with women. I never had the choice to see only women or largely women. And women never had the choice to come to a Women's Center. So it was really very gratifying to be able to build a place where women had the choice. And we were able to grow together. We grew hearing what our patients needed, what they wanted in a Women's Center, because we started small. And when we left 84th Street, we were at 24 doctors. And now we have over 125 doctors in this building. Up
It's
from
incredible.
right, from 9 originally. We have over 20 specialties and subspecialties, and we've added numerous services that were previously unavailable to anyone. We have a Women's Sports Medicine Institute here now that's growing and will be embellished by our Sports Performance Center. We have, I believe, the first cancer genetics, cancer risk program outside of a cancer center in the Women's Center in a regular practice that's will be supervised by the world expert in cancer genetics, who happens to be at NYU, Dr. Smith. We have added that. I don't believe that's in any other internal medicine or general practice. We have added a menopause center, a fibroid center, and many other subspecialty centers that we feel our patients have asked for and have needed. So it's been really gratifying to grow the Women's Center for me.
Why does the collaborative piece matter so much when we're talking about this new collaborative? Why that word? What does it say about healthcare and what's going to happen?
So what it says to me is women are busy. They often, I mean, your story is so typical. We take care of ourselves last. We take care of our children, our husbands, our spouses, whoever they may be, our parents, our grandparents. We take care of everyone else, and we go last. And I hear that story over and over from my patients. I didn't do my mammogram. I didn't have my colonoscopy. I haven't seen a doctor since I had my children. That story is a recurring theme. So the first part of the collaborative for me is making everything easy and available in one place, which was never the case before. And that's what we've tried to do with the Women's Center. So we try to have people come who are extraordinarily busy, either at work, at home, wherever they are, and come once a year. So instead of coming to see me and getting a prescription for a mammogram and a bone density and go see your gynecologist and then go schedule a colonoscopy, we try to do everything in one place at one time. And so a woman has to come once, and she doesn't have to take time off, and she gets everything done, and it increases the likelihood that she will care for herself. That was the first part, I think, of the collaborative. And then the second part that we're growing now is to offer even more services, and now to offer complementary services, so that if a woman comes to see me and has a musculoskeletal problem or an exercise injury. Most women in New York actually do exercise. So if a woman has an exercise injury, I'll send her to the orthopedist, and now we'll be able to send her downstairs to our new Sports Performance Center. And that's the collaborative for me, is working together in one place, making it easy for people to have access to care.
I think it means that the whole person has to be seen, right? And listened to and heard. And it's exciting you can come and do most things in one day, but it's also exciting that there's 20 different specialties here. So it's not just when you come in for your normal checkup, but it's when you have a critical issue that you need to take care of. And you can do that in this institution with doctors who talk to each other. Because they're all in one place, they see each other. I mean, our insurance system doesn't reimburse for peer-to-peer talks. And yet, when I went through menopause, I had to have I was grateful and lucky enough to have my internist talk with my gynecologist, talk with my oncologist, who talked with my endocrinologist, to determine that yes, indeed, I could go on hormone therapy, pure estrogen. Now, that's amazing, because they're all in this building, and they didn't have to schedule appointments and call each other and miss each other. And I think that's part of the collaborative. People will work together, and there will be more connections made. For example, an orthopedic surgeon who gives an older woman a hip replacement will talk to the gynecologist and realize, chances are they're probably going to get a UTI, and they're not going to go back to the emergency room for a hip problem. They're going to go back because they have a UTI, because the movement in their body is all changed. So if you can be prescribed intravaginal estrogen at the same time you're getting your hip replacement, chances are you're going to have better health. That's collaboration, and I think that's amazing.
What are some of the programs or specialties that you've been able to add because of this investment?
One of our dear friends and friends of the institution, but a recent huge donation of $10 million by Ken Griffin, has allowed us to embark upon our journey to build the Griffin Health Span and Vitality Center. And what this means is we hope people don't come in here just when they're sick. They come in here when they want to stay healthy. live healthier, longer lives. We have access to more information about our bodies than we ever have before. We all wear wearable, trackable devices. We all take vitamins. We all do these things, and yet we don't really understand what they're doing from a pure science perspective. And this institution here at NYU Langone is going to be able to have pure science to help people move forward and live longer, healthier lives. So the Griffin Vitality Center to me is the most exciting. Everything's amazing, but it's incredible that we're going to be able to hire these new board certified lifestyle medicine people and do all these crazy things. So I'm really excited about that.
And one other part of the collaborative I just
Yeah.
want to add is something that we really haven't been able to do in the last 13 years. We're going to partner with the incredible depth of researchers we have at NYU downtown and start doing some clinical research here. And I have 3 research projects in my brain already, but we are excited to begin to be able to do clinical research trials here. So that's another part, a new part of our collaboration.
I mean, I think that just to build on that, we are an academic medical institution, and that means academics. We're adding a elective in women's health at the medical school, at our tuition-free medical school.
That's
And
amazing.
we are doing research, and we are caring for the patient, putting the woman first at the center of her care. So we're doing all 3 of those things in a great way at the collaborative.
Amazing. My last question for each of you, what does your vision look like for the future at the collaborative? Dr. Beha, I'll start with you.
Well, I look forward to taking advantage of the collaborative myself. Hopefully,
Same.
I can go downstairs and have a yoga lesson after work.
Yeah.
But I look forward to being able to offer that to my patients. One other thing we added, and we had it briefly, and hopefully we'll have it again, is we added, you may laugh at this, cosmetic dermatology. I thought it was important to offer it here. So similarly, it's what women wanted. So having the ability to go have a sports performance evaluation will be incredible for our patients, because our patients, there's a void there. They are, as I said, many of my patients exercise. Where do they go for advice about how to eat right, how to exercise right? Now they'll be able to go downstairs, and I think it's really exciting to add these extra elements for our patients.
I think for me, it's if we do this right, this is going to have a ripple effect. As the leading academic medical institution in the United States, and as a philanthropist, that is the goal. We want to provide amazing access and care for the individuals who are lucky enough to be able to take the train to come here, but we want our efforts, our programs, our initiatives to go beyond, to empower all women to take better charge of their health and to learn from the things that we have done.